Guys, I'm not getting the link to send on WhatsApp. I've seen two people log on. Um, let me just refresh this and see. Is anyone can anyone send the link to the group, because I'm not getting it on my end here to be able to send the link on my phone. Okay, there we go. I got it. Okay, well, both Salvation, I got it, right? Great. So let us continue. So we were in the middle of discussing patients as self-care managers, and I use an example to emphasize the point that we have medical expertise, yes, but patients are experts of their lives. So it needs to get married. How do we emphasize the patient's role? Simple messages from the primary care provider. Simple messages, no technical jargon. It's something that you hear all the time. Simple messages. And there are some examples in your slide there. A consistent approach. Let's not be haphazard and all over the place. Be consistent and be precise in what you're doing. Culturally and linguistically appropriate. I know we have a linguistic problem. We have a language problem. If especially as we try to address issues with our immigrants. There's Google Translate that can help. And there are in other places. I know in some health centers where the immigrant population is very high, they actually employ bilingual persons to be the preferred provider as a result. Be aware of culture as well. Understand the patient's culture and take that into account when speaking with them about their self-care management. And on slide 14, you have a nice little diagram here. It might look a little busy, but it has there is everything. Assess, arrange, advise, agree, assist. All of these help to develop the personal action plan of the patient. All right? And we're going to go through each of them. Assess the risk factors and beliefs. Knowledge and behavior. And we can use, there's some standardizing assessment, the skills, confidence, supports, barriers, risk factors. And there's a table on slide number 17 that can help you rate metrics. We've been speaking about metrics. So this will help you to rate it on providing feedback to the patient and the care team. It allows the patient's view of progress and how choices relate to their goals. The next step on advising is providing specific personalized information about health risks and the benefits of change. When providing advice, provide patient determined level of information, make the source available very clearly, whether be it um, your literature, whatever literature it is, or knowledge from similar patients. Tailor your information to the person and the environment. Listen more than you can talk. Do we have anyone here in class who likes to talk more than listen? Listen more than talk. Something I know some of us will have challenges with. But it is important to listen more than talk, because when you listen, that's where you're going to get all the information from the patient on their cultural beliefs and the things that they do to, so that you can now help tailor your management support for them. Have a key message for each condition and symptom. Now, this lecture, there were several questions that we got from this lecture, so it's an important lecture. Okay, guys. Agree. Collaboratively select goals and treatment methods based on patients' interest and confidence in the ability to change the behavior. Collaborative, being collaborative. Again, not being instructive. You are not instructing only to the patient. You will need to be collaborative and get their opinion and get them to agree. And you know, from in your previous management courses we did, when you engage with your staff, using staff as an example, and you get them to agree with what your purpose is and what we're doing, it gets executed much better. So you want to collaborate and agree with your patient on the goals and the treatments that we are going to engage in. Again, the same importance ruler, so you can get the metrics involved. Personal action plan, as you can see in the center of the diagram on to number 24, um, talking about something that you want to do. Get the patient to describe it. What are some of the barriers and plans to overcome those barriers, and your follow-up plan? And helping to create agreement, base your goals on patient priorities. Goals generally should be things to achieve in 3 to 6 months. And what can be immediately, I can think of a goal. What is an example of a measurement that we can look for progress in 3 months? Okay, tell me an example, any one of you, an example of a measurement or a test that we do every 3 months to determine the status of someone. I'll look out for the answer while we continue with the lecture, okay? Plans must be behavior specific. Plans are specific steps in order to achieve the goals. The next step is assisting, using behavior change techniques such as self-help and counseling to help the patient um, acquire skills and confidence. All right, we're going straight all the way to slide 33, using this example of an office practice. Precious, you're on point. I love it. Yes, HbA1c is a nice, easy example. Very good, Precious. Of something that you monitor every 3 months. It determines your body's management of glucose control. So that's a nice example. Good. And the lecture continues here with just examples of utilizing self-care management um, in office practices and in other clinics. And we're going straight on now to slide 35, where patient empowerment. We're talking about patient empowerment and empowerment. Let me give a definition here for empowerment. Empowerment is about providing the right environment. Guys, forgive my spelling if it is as I type a little quickly here, right? And empowerment is about I cannot empower you. You have to empower yourself. What I can do is provide the right environment to facilitate you empowering yourself. Okay? So understand that concept of empowerment. Um, Emphasis on the whole patient. The patient generates options. The patient is generating the options. It builds on patient's strengths. Failures are considered learning experiences. Failures, and we did this. We did this in an earlier course, where failures are considered learning experiences. Techniques would include motivational interviewing, problem solving, peer support, empowerment, skill acquisition, modeling, reinterpreting symptoms. Please note that we're on slide 37 now. Patients are very sensitive about being talked down to, especially in this day and age. You have less and less patients who are completely reliant on your information. We certainly cannot engage in the old practice of talking down to patients or giving one-way communication. It must be two-way. You must be interactive. You must be considerate to the patient's responses and feedback to you. And note as well that adults can read above their level on topics that interest them. So it's your role to get them to be interested in things that are related to their health. The other one is arrange. Schedule follow-up contacts, provide an ongoing assistance. You make the arrangements to help them get their management done. Make sure your follow-up happens so the patient trust would not be destroyed. If you say that you're going to have this test done today, or you're going to have this discussion today, ensure that it happens so that the patient trust in your in your abilities don't get eroded. Using outreach and community opportunities. And you know what other than community and outreach opportunities, what can we use in today's world? In today's high-tech world, what are some examples? Methods to reach patients, to reach and interact with, I should say. Give me some answers, guys. In today's, we're talking about using community outreach and perfect, great, social very on point, Melissa. Social media, what we are doing right now, YouTube channels. Um, however, we can reach a patient without WhatsApp video. All of those things are quite useful to help the patient understand. I have many patients that I would talk to via WhatsApp video, WhatsApp chat. However, we can use free resources, free resources of communication to have better interaction with your client. Okay? So when we talk here in the lecture about community outreach and community opportunities, I know you might think you have to go to the health center in their room and there's a group of patients and you have a lecture. No, it's not that. Not only that alone. You can do follow-ups with your Facebook Messenger, with your WhatsApp, with your video calls, on on seminars, webinars as we have now. So slide number 40 looks at the opportunities for a self-management support, and there's a diagram that shows before the encounter, during the encounter, and after the encounter. And we have some just little diagrams that can show after the encounter, the person is being able to be communicated from remotely. All right, so before the encounter, pre-visit contact via phone. You call them before, you send them a text message before. In your waiting room, you have an assessment done. Patient education material would be available for them to look at on their own, posters, those things. During the encounter, feedback is taken from the patient. You get their feedback. Remember, as I said, the conversation is two-way. It's not it's not one way. And I want to ask right now, you guys, are you aware of the clinics? Have you been in clinics, chronic disease clinics? Have you guys been in chronic disease clinics with the prescribers? And have you seen how it's done? Have you guys been on rotations in those health centers or hospitals where there are chronic disease clinics and you get to sit in with the prescriber? No? Oh, okay. Well, okay. All right. Well, I was asking, hoping that you would have first-hand experience, but the reality is, unfortunately, the system is structured in such a way where there are so many patients in the clinic. There are, um, and all are rostered for not yet. Okay. So you will actually see where what we're talking about does not happen. In most of the instances, unfortunately, the when a patient goes in finally after hours of wait to see their clinician, their clinician have received so many feedback from them. They would not sometimes would not even raise their head. They would look at the page and say, "Good morning, Mr. So and so, Miss So and so," and they would start writing immediately and start just rewriting the exact same prescription that they would have gotten before. And that's not what we want. We want actual feedback from the person so that we can look at what the goals were before 3 months ago or 6 months ago and what have we achieved them and what new goals do we have to set now. All right. And after the encounter, we look at phone calls for follow-up text. But you have to do phone calls. Phone calls are at a cost. You can use text messaging. You can use WhatsApp chats. Nowadays, almost everyone has a smartphone that has WhatsApp capability. Peer support, follow-up visits, email, internet sites. Now, this lecture talks about email and internet sites, but from then to now, we've had so much more easier access and smoother communication opportunities via WhatsApp, etc., Facebook as well. All right, so the people who can help with patient management support would be natural helpers, trained pairs, health educators, nurses, physicians, and any caring person. So, of course, your role is there as well as we are healthcare professionals as pharmacists. And slide number 46 talks about the philosophical shift of this large distance between the professional and the patient, and that distance becoming smaller and smaller. And then you see a flip of the patient, now talking to the professional, and now it becomes where you recognize the interaction as one person talking to another person, and the only difference is that these are two people, one with some medical expertise and one with the actual symptom, and it's a perspective, it's a it's a shift of paradigm to look at the interaction of a healthcare clinical interaction as a person to person, one with the ability to help and guide, and one with one trust entrusted with the responsibility to execute. And that's what patient self management support is about. It's about moving from this large gap that exists between patients and the caregivers to one where both see each other as individuals, and one don't look at another one very high up, and one is below. They both are the same level. They both interact. They both work together at solving a problem. And as pharmacists, as you go out there into the working world, whether be it institutional or whether be it community or on your own, your role is to help patients solve their problems, and you need to work with them. And you can find creative ways. I know in a hospital setting, pharmacists, the physical structure isn't there to allow and facilitate interactions, but you guys could find creative ways. I am sure your public healthcare patients will be happy to share their phone numbers with you, and you can reach out to them. You don't have to wait on policy development. You can create your own policy to help patients better manage their conditions and better manage their diseases to produce better outcomes. And it's actually it would be a very good idea to pool your resources and pool your talents together, create um, a self management support system that you can launch in one of those large tertiary institutions, and create within it a monitoring and evaluation component. And you have your metrics, and do your metrics, and let's just look at one thing we can look at, whether it be some chronic disease, whether it be asthma or high blood pressure, hyperlipidemia, and you create patient management support systems for this particular clinic. You create your metrics, you create your measurables, you reach out to them. Then there's nothing wrong, there's nothing keeping you back from getting a database. If it's too difficult to get it from your own records department, you can get it when they present to you with their prescriptions, and you can get it done. So it's an encouragement for you guys to get your to do this, to encourage more patient self-care management. It's certainly the way to go. It's definitely where you're going to be getting better outcomes, and you would see patients taking more and more responsibility for their own health. It's always a good thing. Is you wanna When patients do this, they will have better use of resources. They will be making better decisions from a home standpoint, and they can now give advice to persons to improve their healthcare status as well. All right, so that's the end of the lecture, and I invite questions from you guys. As I said, there were several questions from this lecture in your exams, so please read it through. If you have any questions, you can always let me know. Um, we are going to do next we are going to be doing the final lecture, which would be quality improvement in healthcare, which will hopefully tie in all of what we've done from the perspective of quality. And I am waiting on questions from anyone. Are we good? All right, so no questions, guys. All right, we will start off with quality lecture, and then we'll take a break at 10 to. So let's get some stuff in there right now. So quality improvement in healthcare, as you would know, or I hope you guys know, that in all tertiary institutions, there is a department of quality, whether be it public or private, and even some secondary health, yes, secondary healthcare facilities as well. They have opportunities to measure and to take feedback for quality control in healthcare. Naturally, you can appreciate that when it comes to healthcare, quality is something that should be monitored and measured and evaluated. And everyone wants to have the best possible healthcare that they can afford. So quality is very important in your in healthcare improvement. So quality improvement in healthcare. So let's go. So healthcare as defined in this lecture is a system that a nation has built up and continuously maintains in order to combat disease, death, disability, dissatisfaction, and social disruption. Healthcare is a collection of curative, preventative, rehabilitative, and promotive services. Healthcare is also a social and economic endeavor encompassing activities, providers. So these are some definitions of healthcare with respect to quality. What's wrong in today's healthcare? We have immediately you can think dissatisfied clients. They think that they are disenfranchised. They think that they are not treated well enough. You have avoidable errors, and I want to emphasize to all of you. Nicolette retracted a question. How do you retract something, right? I didn't even know you could do that. Or you could remove. Okay. All right. So in well, we all know that the practice of healthcare is indeed a practice. It's not an exact, perfect. Biana, what is you laughing at? It's not a perfect science. So there will be inevitable errors. There will be issues where errors occur as a result of negligence, which can be prosecuted, or errors that occur out of, how we would call it, accidents, unintentional mishaps that seem to be, as we say, freak accidents, right? So quality hopes to address avoidable errors, underutilization of services, overuse of services, variation in services, communication problems, dissatisfied clients. Quality can fix this. And I want you to get familiar with some terms here: quality assurance, total quality management, and continuous quality improvement. And you may be familiar if you look at some of your products, especially your electronic products and some of your children products, you would see QA tested, or QA compliant, QA quality assurance. And then total quality management is actually specific management for for managing the quality of your products. It's a management tool. And continuous quality improvement is for organization and is an organization and managerial mechanism for quality assurance in the health sector. So understand those three terms, please: quality assurance, quality, total quality management, and continuous quality improvement, QA, TQM, CQI. So some dimensions of quality. When we look at quality, what are we looking at in particular? We look at performance. Does the product do the intended job? Is it reliable? How often does the product or service fail? The durability, how long does the product or service last? The serviceability, how easy it is to repair. The aesthetics, how does it look? What features does it have? The perceived quality, the reputation, the perceived quality, the reputation. Conformity to standards. Those are things that we look in terms of the dimensions of quality: aesthetics, perceived quality, conformance to standards, performance, reliability, durability, serviceability. And on slide number 7, you would look at the different types of industries and examples of how quality is monitored in these different industries. Airlines want online, comfortable, low cost service. Automotive wants defect free. Communications, they look at clearer, faster, cheaper service. Food services, you want good, tasty products, fast delivery, good environment. Healthcare, correct diagnosis, minimum wait time, lower cost, and security of healthcare information. So, what is quality? The British defense industries define quality as conformance to specifications. A quality guru by the name of Philip Crosby, he said quality is conformance to requirements. Another quality guru called Duran says quality is fitness for purpose or use. Edward Deming, one of the persons who spoke a lot about quality, says it's a predictable degree of uniformity and dependability at low cost suited to the market. Another one says it's synonymous with customer needs and expectations. Robinson said it's meeting the stated requirements of the customer now and in the future. And another guy had a long definition of a total composite product or service, characteristics of marketing, engineering, manufacturing, maintenance, through which the product and service in use will meet the expectation. So I get that. That's just a long one that matches product with expectation of the customer. And the first two that we discussed was product and conformance to specifications. So there's a little difference there in a general difference between the larger of the two definitions. So the slide number 9 talks about quality being the degree to which a system, component, or process meets one, specific requirements, or two, customer or user needs and expectations. The totality of features and characteristics of a product or service that bears the ability to satisfy stated requirements. And ISO is the International Standards Organization, and you would see ISO on many products, but to get ISO certification, there are certain things that must be present in your product or in your organization to get ISO certification. So when you see a company that boasts of ISO certification, you can depend on such a company to get quality products of a certain standard. So some other definitions of quality, people talk, when they hear quality, they think excellence. They think product-based definitions would be the quantities of product attributes that meet certain criteria. Value-based definition looks at quality versus price. Manufacturing-based definitions talks about conformance. User-based definition looks at fitness for use or intended purpose, purpose-built. Quality is about being realistic but demanding high standards. Providing the best possible standard given the resources that you have. That would speak about quality. Getting things right the first time. It costs a whole lot less to prevent a problem than it does to correct a problem. And guys, health promotion, I mean, prevention. Health promotion is about prevention because it costs far less to engage in health promotion activities to prevent 10,000 people getting diabetes as compared to having to treat 10,000 people with diabetes. So that's where it costs far less to prevent something than to treat it and to correct it. Quality influences your relationship with customers, and it influences how complaints are dealt with. Quality is also about something to do with how things look and feel. Now, let's deal with your relationship with customers and complaints. Now, some of you, when you do get out there into the working world, you might think a customer complaint is a bad thing. But a complaint is feedback. Accept this. You need to accept this wholeheartedly. A complaint is feedback on your organization, on your process. Yes, the manner in which the complaint is given to you, the communication, and we know all about communication. We've spoken a lot about communication. And yes, we are not in control of the customer or the person giving us the feedback. We are not in control if they speak loudly, if they curse, if it is they insult, but it is information nonetheless that we need to be able to process. And I want you to start getting accustomed to persons giving you feedback in the form of a complaint. A complaint is not something bad. A complaint is feedback that might feel uncomfortable, that might be insulting, that might be embarrassing, but it's feedback on how your process is working. Is it getting it done? Is it causing problems? And it must be treated with the right amount of attention. So please take home your complaints and your compliments. That we don't have to talk about compliments because compliments, of course, have with it a positive connotation. But complaints also can be seen as good because it provides us with feedback. All right. And in all, you look at all quality managers and you look at what they do and what they're responsible for. And one of it, and you would see in most companies, a feedback form or contact us on their website, give them information that they would want to improve their service delivery or improve on their product. And I encourage all of you, when you purchase a product or when you experience a service, that you actually engage in the evaluation of the service. The university actually engages in assessment of lecturers, assessment of courses, and I encourage you all to do it because by doing this, by doing those things, we learn to improve on how we teach and how we ensure that the students get the right information. And it applies. I'm using this example that you are in right now, but you go out there and you buy a product. It's a good product. It's an excellent product. Go ahead and give feedback. You are encouraged to give feedback because feedback is what feeds into the organization's ability to fix, correct, change, adjust. All right. So give your feedback. I would suggest also you give your feedback whilst you are under a sober head. Sober meaning not under the influence of emotions that can discolor how you make your complaint or give your feedback. But give your feedback. Feedback is good. Complaints are good. Compliments are good. Okay? So the modern importance of quality, the first job we have to do is to give quality merchandise to consumers that will keep on buying. If we produce it efficiently, economically, we'll earn a profit, and that's excellent. And slide number 12 is excellent. This is if it is you are in manufacturing, you can really relate to this. You have a good quality product. Consumers will keep buying. If we produce it efficiently and economically, we will earn a profit. Can you give me an example? Can anyone give me an example of this? A product that consumers love. Let me get it right here. Quality merchandise that consumers will buy and keep on buying. And if we produce it efficiently and economically, we will turn a profit. Can you give me an example that I am sure is so easy for us to think of in Trinidad and Tobago of a product that is good quality? KFC, yeah, that's it. You're correct. You're correct. We love KFC. We love a KFC. I don't know why, but we love it. Well, we know why. And we can continue to use KFC as an example, but not a good health example, but it's an example of an excellent product that has consistency. That you can open a KFC anywhere, and you will have customers. You'll always have the longest lines in any food court is by KFC because we love this fried chicken. And sorry for those who are vegetarian. I think Vasudeva is a vegetarian. Um, but it's a product that people buy continuously and consistently, and KFC themselves as an organization, they continuously improve and become more and more efficient, so they turn a profit. So KFC is a good example of quality in terms of their products. All right, the actual product of fried chicken. We can look at the product of the service delivery. We could look at the product as a whole of KFC selling us fried chicken. Now, they don't use robots to sell us, they use people. And I know that there have been, from time to time, some gaps in having the best service delivery from these guys. But you all need to be aware that the education level and all of those social and socioeconomic factors do affect these persons' abilities to have good human interactions. Um, lack of training and sometimes even with the best training, it's incumbent on a person to take the information and learn and grow. So, and that's something that we could talk about at another time. So yes, thank you for that example, KFC. And we get it's slide number 13 just goes back from a historical context on quality, looking at China, India, Greece, Roman, and the Roman Empire. And we continue again here, looking at the historical perspective of quality. And more examples, go up to slide 15. We're on to slide 15 now. And slide 16 as well has some more historical context of quality. And you see the last point on slide number 16, the ISO International Standards Organization that was developed. All right, so let's go take a break. Do we have any questions on what we've done so far? And we're going to return at 11 a.m. Any questions, guys? Because yes, in the latest parts of this lecture, we have some things that we need to go through. The second half, so I want to start off that fresh from 11 a.m. Any questions? Hi, any questions? All right, so no questions. I'm going to end the stream and we're going to come back at 11 a.m., okay? We're going to take a break now.